Greetings to all interventional cardiologists and interventional cardiovascular specialists. This specific episode deals with a taboo subject that most of the interventional cardiovascular community considers as a weakness, which is complications. And all of us get trained on how to deal with complications from a technical standpoint through algorithms and different techniques, but very rarely, almost never, we talk about the psychology behind it, meaning what goes on in our heads and hearts as interventional cardiologists when we are facing complications. This is the second episode of PICS, Practical Interventional Cardiovascular series, that discusses matters that are not often encountered in the cardiovascular literature and affect our daily practice. So, first of all, let's address the elephant in the room. Why is this considered as a weakness? Um, there are a lot of factors that play into the psychology of when a complication happens. Uh, when a complication literally happens and gets acknowledged by the interventional cardiovascular specialist, a rush of a huge amount of emotions comes into play. Those emotions have to do with number one, feeling like you have or we have failed the patient who trusted us and came to get help, and now we induced harm and we are trying to get out of it. Number two, the issue of kind of failing yourself after years and years of practice and training and hard work. One feels like um, he or she failed him or herself by seeing such a disastrous catastrophe happening in front of their eyes. Thirdly, the staff working with you who trusts you, and often you're this early career, mid career cardiologist who are, and kind of this raises the question of their confidence in you all of a sudden. Same thing about your partners, about the competitor cardiologists from other groups. You worry about what people are going to think about your skills, about your ability to fix problems. And finally, we all live in a data driven environment where data is getting analyzed at the end of each month. And you worry about obviously your numbers being horribly affected by that. So, all these emotions come into play in that second when you recognize that complication. And it is extremely rare that someone helps you kind of navigate the complexity of that in your head and how to deal with that. Obviously, we started on a negative note. The positive note is that most of us, and I speak for myself, for the last 10 years of my experience, I've accumulated a number of complications, and they were um, one of the best learning experiences of my life. And they made me a better cardiologist, a better person. And I think these are very teachable moments. And there's a very good way to go through this as gracefully and peacefully as possible. Of course, we want to do everything in the world to avoid them, but there is a way to navigate the psychological complexity of what goes on. This is a huge topic. We'll be addressing this in multiple sessions, but this is just an opening session. And I would love to get the feedback and the comments of most of my colleagues who have, each one of them has a unique experience that they went through where they can help a lot of early career cardiologists go through that and help patients out there without having to learn all this on their own. We can share our experiences and learn from each other and make this a better world. To the next episode, we'll see you soon. Thank you for listening.